Hello once again and welcome to Anatomy and Physiology at Glen Oaks Community College. I'm Dr. Ren Hartung. And for this video we're going to dissect a cow's eye. This is a fresh cow's eye. It has not been preserved. The cow was probably slaughtered earlier this morning. First we'll look at the outside gross anatomy. This part in front that looks very dark, that's the cornea. It's actually clear. And if you can see it close enough, you can actually see the iris, the brown iris inside, the large oval pupil, and the cows have oval pupils, and of course darkness beyond because of pigmentation inside of the eye. You have the white part out here, which is called the sclera, and because this one's nice and fresh, we can try to lift up and show you the conjunctiva. I trimmed off most of it kind of by accident when I was getting it out of the cow's head. But this that I'm pulling up off here is conjunctiva. Note also that this cow's eye has a lot of fat around it. We have fat around our eyes in back as protection so that the eye can move in the socket if there's a blow to the eye. The first thing I'm going to do is try to dissect off that fat and connective tissue. Fat and other connective tissue, I should say. In back here, if I reflect away the connective tissue that I'm trying to remove, you can see the optic nerve here. And the way I do this is I start back here at the optic nerve and start removing tissues going down. Works really well, at least on fixed specimens, but I think this eye is going to give me some trouble. Let's get the scissors. I think this may be the best method. So there's lots of fat, connective tissue, and muscle that surrounds the eye. Okay. So this is the cow's eye with most of that connective tissue removed. You can really nicely see the optic nerve now and the way it comes off of the back of the eye. And you can see that whitish sclera over the entire surface. It's also thin enough so that you can see some pigmentation underneath of the sclera. Human eyeballs actually have a thicker sclera than this, so you can't see the pigmentation underneath. The next thing I'm going to do is to open up the ball of the eye so that we can see the vitreous humor and then the structures towards the front of the eye. I made a hole with my scalpel, and now I'm going to take a scissor and just cut all the way around in a circle. This way I leave the ciliary body undisturbed for the moment. And if I'm lucky, the retina too. I've got the cup dissected into a front and a back half, and I will separate them. And the retina was disturbed, unfortunately. We're looking down at the front of the eye through the vitreous humor right now. The vitreous humor is this jelly. It's a very thick, kind of gelatinous substance. There's actually collagen in there to help it keep its structure. And I'm going to try to remove all of it from the front of the eye if I can. You can see how clear the vitreous is. That's because this was a very young cow. In human years, this cow would have probably been a teenager. In elderly humans, the vitreous takes on a little bit of color. It takes on a little bit of a yellowish hue. And that does affect color sensation as we age. I've got most of the vitreous out, and if you look close, if I can get you close enough and still in focus, you can see the lens right here. And it's still attached to the ciliary body, this dark ring, by suspensory ligaments. I was hoping to be able to dissect out the vitreous and be able to see the suspensory ligaments better. But I don't think this eye is going to cooperate. I'm going to invert this front part. One thing you're able to see is you're seeing through the lens and to the metal dissection table underneath. You see that light spot in between. Notice that the iris in the cow is not round like in a human, it's oblong. Still trying to gently remove vitreous. I'm not sure you can see it, but I'm starting to see these little ridges here next to the lens. And those ridges are indicative of the ciliary body. So we got ciliary body attached to and surrounding the lens. And I'm going to try to carefully dissect around the lens and see if I can get the lens out intact. It's usually not very hard because the suspensory ligaments are not holding on very tight. There we go. And that's the cow's lens. Compared to the fixed version, as you can see, the cow's lens is very clear. The fixed sheep's lens that we've looked at in my class is very opaque, and it's akin to what a cataract might look like, an extreme cataract in a person. So that's the lens. If I take it sideways, you might be able to get an idea of how squishy it is. It has to be able to accommodate, it has to be able to change its shape. And in a nice young cow like this, it would be able to easily change its shape. As we age, of course, however, the lens becomes more brittle, and we develop presbyopia. Usually that means difficulty seeing things close up. All right, with the lens gone, if I invert this once again, you might be able to better make out the ciliary body. Actually, it doesn't look that much better than when the lens was in there, but right around here is ciliary body. And the iris, I can get my, should be able to get my forceps underneath the iris. Finally, this part here that I'm lifting up, that's the iris. Let's look at the back of the eye. We see the dark choroid. Cows have a reflective surface here too. And the reflective surface helps them to see better in the dark. This kind of, I guess, light gray, maybe tan substance that I'm pulling here is the retina. Notice how delicate. This is nervous tissue. Remember how soft the brain was? This stuff is very soft too. And you can still see a bit of vasculature in there. Oh, sorry, the focus is gone. You can still see a bit of blood vessels in there. And again, this is the retina. The optic disc. Notice where the retina is coming from right now. I've lifted it off of the choroid layer pretty substantially, but there's one place here where it's not letting go. And that place is the optic disc. If I remove the retina completely, if I can do that without damaging things too much. Then that little bit of retina that you see left is right where the optic disc is. And the blood vessels where they were coming from before, where they were the most thick, that's going to be the optic disc as well, if you look at the video in that earlier spot. And that's the dissected fresh cow eyeball. As always, if there's any questions, comments, please email or call me. Thank you very much for watching.